My name is Sarah Cisse. Today I'll be doing a neurological assessment on my patient. So I'm gonna perform hand hygiene and enter my patient room. Hi, my name is Sarah Cisse and I'm your nurse for today. Would you please verify your name and date of birth for me?
Jacques Lemassé, 0501.
Alright, thank you. May I please have a seat here? Is your room comfortable? Is the lighting okay? The temperature okay in here? Okay. Okay, Mr. Jacques, today I will just be doing an assessment on you. It's a neurological assessment. I'll be asking you a couple questions and I will do an assessment from your head down to your toe. Are you comfortable with that?
Sure.
Okay. So just to get a little quick history on you, you ever had any headaches? Okay. You ever lost consciousness or feeling dizzy?
No.
Any lightheaded or fainted?
No.
No. Have you ever had like any involuntary movement to your muscles?
No.
No. Do you have seizure or any history of seizure?
No.
No. Have you ever had like any tingling and numbness, any part of your body of any sorts?
No.
No tingling and numbness? Have you ever had a head injury or hit your head of any sorts?
No.
No. Okay. So as I said, I'll be doing a neurological assessment. Do you mind telling me where you are at the moment?
At the house in the living room.
Good. What's the date for today?
Thursday, April 9, 2020.
Thank you. What's the name of the current president of the United States?
Trump.
Right, thank you. So usually we have an acronym that we use to teach every patient. It's called FAST. So with F meaning facial drooping. If you notice any facial drooping on yourself or any family member or any abnormalities of the face, that's what the F stands for. And the A is for arm, like any arm weakness or any abnormalities with your arm. And the S is for slurred speech or difficulty forming your words. And then the T stands for time. So if you notice any of these signs that I've stated, you should go to the emergency room as fast as you can. Okay? Okay. So now you're ready to answer that for me. So I'm just gonna go ahead and start my assessment. Okay? So I'll put on gloves at this time and assess my patient's hair. Just look for hair distribution and see if I can note any molds, lesion, or any thin hair of any sort that's abnormal. And then I put this down. So I have lavender here with me. So I'm gonna let you close your eyes and tell me what you smell. Okay?
Good.
What do you smell?
Something good.
Yeah, but what is it? What is it?
Lavender.
All right, thank you. And I'm gonna use my pen light. So I'm gonna. This is a light here, so I'll dim the light in the room, and then I'll go ahead and use my flashlight to assess the pupil. So I'm just gonna do this close your eyes. Just look at it. Good. Now I'm gonna bring this closer to you. Just look at the pen light, okay? It's gonna take it away. Good. So your pupil is round and they're equal. They're reactive to light and they're accommodating. So now with this pen, I'm gonna do the 6-point of gaze. So without moving your head, just with your eyes follow the location of my pen light, okay? So down here. So, okay, I'm gonna come here. Good. Don't move your head, just your eyes. Good. Okay. Gonna put that down. And would you clench your teeth for me? Would you smile for me? Okay. Would you close one of your ears? I'm gonna whisper something over here and I'm gonna ask you to tell me what I said. Just close one of your ears.
black and white.
Alright, would you do the other one?
Blue.
Okay, thank you. And then, now would you just show your shoulder for me? Good. So far, my patient is able to answer my questions, okay, and they don't have no hoarse voice. So would you swallow for me while I do this? Do you feel any pain or soreness while swallowing?
No.
No? Good. So now I'm gonna go down to your extremities. So would you move your arm away from me? I'm just trying to see how you can flex and extend your ankle, your elbow, sorry. Good. And now let's do your wrist. Good. And so your thumb, would you bring it closer, like inward? Yeah, good. And that one. Good. And now would you do your fingers for me? Just, you want to open them and close it. Do it by yourself and do it. Yeah. Do it. And now let my patient do it again on the other arm, and now compare both of them. Good. So now, for your hip, would you just fold your leg up for me? Good, and put it back down. You know how ladies sit and they cross their leg? Would you do that for me? Good, and bring it in. Good, put it back down. Now would you extend your knee for me? Good, and flex it back. Bring it back towards it. Good. Now would you do your ankle for me? Just your ankle like that. Good. Good. And now your fingers, would you do your just do your finger like that? I just want to see how your fingers, you do a finger movement. Good. And now let's do the finger to nose. I want you to touch your nose and then touch my finger. Do it again. Thank you. And now let me see your finger. So close your so this is up, down, up, up, down, down. So now you close your eyes and tell me where I move it, okay?
Up, down, up, down, down.
Okay, so now with your eyes closed, I'm trying to test for propionation. So just tell me where I move your hand, okay? So close your eyes and tell me where.
Up.
Okay.
Down.
Okay, so we're gonna do one more position. Now close your eyes and tell me where I move your arm.
Away from my body. Towards my body.
Okay, so now would you stand up for me, please? And I'm gonna move the chair out of the way. Would you come back a little bit? And I just want you to put your legs together. Just trying to see how you roll your body. Good. So now would you walk a couple steps for me? Good. And come back. Okay, now I would like you to do for me toe to heel, and toe to heel. Thank you. You can come back. So now while you're standing, now I want you to close your eyes. So that was the lumbar test. It's called the lumbar test, but I'd like you to just, with your eyes closed, you just raise your hand up and turn your palm upward, but close your eyes and turn your arms upward. So I'll support my patient at this moment because in case they're lightheaded and might feel dizzy, to avoid the risk of falling. All right, thank you. You can have a seat now. So that complete that part. So I'm gonna grab a couple things here so I can test your sensory. So I have paper towel here. I'm just gonna be testing for a light touch. So I'm gonna touch this on your skin and you let me know if you feel light and let me know how you feel.
It's light.
Okay, I'm gonna do the other arm.
It's light.
Okay. And so I have Q-tip here. I'm gonna do the inner forearm of my patient. Is it light?
Soft.
Soft and smooth. Okay, and I'm gonna do it again over here.
Soft and smooth.
Okay, and I'm gonna do it again here.
Soft and smooth.
Okay, I'm gonna do it again on your cheek.
Soft and smooth.
Okay. When if my patient was at the hospital or clinical setting, they'll be having their hospital gown on. So I'll do the same sensory test and ask them to close their eye on the inner thigh in both of their legs. And then I'll do it on their calf medially and laterally. And then I'll do it again on their foot so they can feel it. But because he has this gene, he's not going to be able to feel it as much as I may want him to, but I would have done that. So that is for light touch. So now I'm gonna assess for pain and temperature. So now I'm just gonna do the Weber test. I'm using the fork here, I'm just improvising. So I'm gonna hit that and I'll put it in.
It's vibrating.
Yeah, but yeah. Okay. Now go ahead and I'll put it again behind the ear, like by bony promises. Okay, and I'm gonna check for that was a Weber test. Now do I get the vibration here?
Yes.
Does it feel vibrating?
Yes, it does.
Okay, now do it again with the feet.
Vibrates.
Now do it again.
Yeah.
Good. And now I'm gonna assess for pain. So let me, you gonna close your eyes and tell me where I'm gonna stick this in and tell me how it feel.
Hurts on my left arm.
Okay.
Sharp pain in my right hand.
Okay, hurts. Okay, and I did it again in the feet.
Sharp pain on my feet, left feet, right feet.
Okay, good. And I'm gonna check for temperature. I have a little bigger here, so I'm gonna roll that. So let me know how you feel.
It's warm. My left arm, right arm.
Your right arm. Okay, I'm gonna do it again.
My left arm, warm.
Okay, and I'm gonna use my fork again, and I'll check again for temperature and cheek.
Cold, right cheek.
Okay, shoulder.
Right shoulder, cold.
Okay.
Left arm, cold. Right arm, cold.
Okay.
Right arm, cold.
Okay. I go ahead and do it on both the right and left side arm of my patient and let him tell me how it feels. So that completes that part. And now I'm gonna do your toes. So this is a little toe. So this is up, down. So you close your eyes and tell me where I move it.
Down, up.
Okay, and I'm gonna do the big toe again. So now you can look. So this is up. This is down, 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 up, up. And so you close your eyes and tell me what I do.
Down, up, down, down, up, up.
Okay, good. And while I'm down at the foot, I'll go ahead and do my reflexes. So now I'm gonna start with his bicep. So I'm gonna locate it's like a cord. It feels like a cord right here. And I tell him to relax, just relax. Now I'm using my stethoscope as a patella armor, just improvising. Good. I can feel him flinching, and there's a contraction on this muscle, and while this one just come up a little bit. I'm gonna do it one more time because this is cool. Good. Now do it again his knee. Now so I'll locate the point right here, and I'll do it. Feel that, and I'll do behind his plantar right here. Good. And then now to get the rest pulse, I'm just gonna roll my hand on his feet. Oh, yeah, that one. Yeah. What am I missing? I think I got everything pretty much. So this concludes my assessment for today. Thank you so much for letting me to help you. Do you have any questions for me?
No.
Thank you. So after this assessment, I'll go ahead and document all my findings. Thank you and have a good day.
You too.
Bye.